Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith Rogers, producer of Public Health on Call, and today is Inauguration Day 2025, and we're bringing you a conversation about common ground in public health. Brian Castrucci is president and CEO of the Beaumont Foundation, a philanthropy devoted to supporting state and local public health agencies. He speaks with Dr. Josh Sharfstein about the opportunity at a divisive moment for public health to appeal to people across the political spectrum. Let's listen.
Brian Castrucci, it is great to have you here on Public Health on Call. How are you doing today?
I'm doing great, Josh. How are you?
I'm doing pretty good. We're 1 week away from a change in administration in Washington, D.C., and a lot of questions about what's going to happen. There's a number of areas that are emerging as possible flashpoints. I'd like to think about some areas where public health can help bring the country together.
There are so many things that we can debate in public health, but there are so many things where we can find commonality. When you look at challenges around opioids or depression, these are things that are bipartisan. And we need to find a way to work together to solve these problems that impact, every American.
I'd like to ask you to introduce the Beaumont Foundation to our listeners, because it's such an interesting organization and you've done such great work.
Well, thank you. The Beaumont Foundation is a private foundation in Bethesda, Maryland. And while most philanthropies just give grants, we actually run a number of our own programs. We have things like City Health that works on policy. We just come out of the field with the PHWIN survey, which is the largest survey of the governmental public health workforce ever conducted in the history of all time. We really focus on the people, the policies, and the partnerships necessary for every community to achieve its optimal health. And that's including the business community, which often gets neglected, but it's one of our key partners, especially going forward in this inauguration. If the business community can really be a full-throated champion of public health, I think we're going to do better than if they're silent.
You don't just work in blue states or red states and blue areas or red areas.
Public health practitioners help everybody. There's not a purity test that says, those folks don't agree with us, we won't help them.
Now, I understand that during the pandemic, you were one of the only foundations that was specifically reaching out to disaffected rural conservative voters and individuals about the vaccine. Why did you get involved in that work?
Well, they're an important community that was otherwise neglected. And so Beaumont tends to go where no one else is. That's part of our special sauce. It's not, Wayne Gretzky says you go where the puck is going. We got to go where the puck hasn't even thought to go yet. And so I threw out a tweet one night that said, we need the help of Republican pollsters. And the next day I got a call from one of the nation's leading Republican pollsters, Frank Luntz. And we were off and running, talking to elected leaders and folks at the state level and conservative leaders about the importance of vaccination. And I think we made a difference. People used our language to help conservative voters think about the vaccine differently.
So let's turn to 2025. We could spend a few minutes listing all the areas that we think people will be arguing about, and you and I may be very much involved in those arguments. But I just want to take one moment before it all starts. What are the areas where we can expect or at least hope for real agreement and progress despite the political differences that exist?
So I think if you look at children's health, that is something that is universal. There is not a single person who wants to bury their kids. And I think that's really important. Vaccines aside, that's going to be a point of debate, but keeping kids insured, keeping kids healthy, that's going to be a priority for everybody. You can sell that to both sides of the aisle. when you think about opioids, there is an equal proportion of Republicans and Democrats who know someone who's died of an opioid overdose. And so that's, again, a point where we can build. And mental health. The mental health epidemic in our nation doesn't discriminate by political party. Mental health and depression is purple. It's not red or blue. And so we need to build on those commonalities. We can list the differences all day long, but our focus has to be on where we have similarities and where we can make progress.
You know, a few years ago, we hired some graduate students to design an app that gave the health statistics for a county. And then you had to guess whether the county had voted Democratic or Republican in the election. And it was kind of like the movie War Games, although we're dating ourselves a little bit. It was unwinnable because there was so much overlap in the health challenges and the health rankings. There are Democratic counties and Republican counties that are suffering mightily. And it gives you at least the sense that if we can get some common focus on major causes of death, that we can find ways to work for common solutions.
The difference is in the movie, the computer finally figured out that it couldn't win. And so they adapted a new strategy. We have to adapt that new strategy. I mean, let's face it, America is not the healthiest nation, despite spending more on healthcare than any other nation. We invest in defense and not our people. And we have to change that. We want to be the healthiest nation. We deserve to be the healthiest nation. But we have to understand that we're not. And that might mean looking at our institutions, being open to hearing dissent and different ideas, and trusting that we can show people that the science will help guide us. And so we have to start really thinking about how we're going to let people know what public health is and how we deliver value to the American people. That's the real key. We have to deliver value.
Now, let me ask you this question. Do you think that these two paths are mutually exclusive or they can overlap? On the one hand, jumping into debates that may be coming over vaccines, like you mentioned, or other hot button issues. And on the other hand, delivering progress on common goals. Do you think that those can overlap? Is public health as a field needing to engage in both? What's the value of doing those projects that can build coalitions at the same time you're standing your ground on the other issues?
I think there are many different kinds of people in public health, and we can all advocate in certain ways. For me, when it comes to the more hot button issues, I'm not giving an inch on the science. I'm not giving an inch on the facts. But yelling into the void at someone who's yelling back at you into a void is not helpful. We're in a really weird time when we have to remember that your facts are my misinformation and my misinformation is your facts. And this makes it really hard to kind of just push through with science and say, look, I'm right, follow me. So I'm going to stand on the science. That's what I know. And then I'm going to be there to help find those things where we can work together. If people from the administration want to meet and talk about children's health, I'm there. If they want to talk about mental health, I'm there. Now, hopefully, the one thing that I love about the job that we do, the work that we both have done all our lives, I really love that the outcome is rarely in debate. We want, fewer people to have mental health crises. We want fewer people to die from opioid overdoses. What is often...
We're not arguing about whether trade deficits are good or bad.
Absolutely. We have common outcome. What we debate are the tactics. So let's have that conversation. What allows us to get to these goals that we all kind of agree on? And no one in Congress is saying, let's have an uptake in child mortality. Let's see how many kids we can actually kill. That's not really the goal here. So we can agree that we want healthy kids. We want healthy moms. We want a healthy nation. The question is, and the debate we're having, is how do we get there?
There are a lot of people who work in public health who have become disillusioned. You mentioned that you do a big workforce survey. A lot of people have left the workforce. People are checking their watches, looking at the calendar, not knowing what's coming, whether it's change they'll like, whether it's change they won't like. What's your message to them?
This is the greatest workforce there is. And there is tremendous resilience and tremendous hope amongst the workforce when I'm meeting with people around the US. The data from our most recent PH wins is just coming out of the field, and I'm looking very forward to seeing what those data tell us. But our work, it doesn't end. I hope it will someday, but for right now, we're going to be here. We're going to do the work. And I would say to anybody who is thinking about leaving governmental public health to be just thoughtful that there's a lot that you can still do in governmental public health, even if your elected official doesn't necessarily agree with you. But you have to make the partnerships that can speak for you. I don't ever want to go into a legislature and talk about public health again. I don't, as a public health practitioner. I want the local clergy doing it. I want the superintendent doing it. I want the person who is the largest employer in my county. I want them doing it. We need to help our workforce by upskilling them with a different way of communicating, with a different way of marketing, with a different way of building partnerships. Public Health 3.0 was amazing. And it said we should have more partnerships, but it didn't tell us how. And so that's, if you look at like the Health Action Alliance is working with businesses across the country on their public health needs. Because you know who's on the front line of the mental health crisis? America's businesses. So let's get them involved. Let's get them off the bench talking about public health and its value.
Yeah, if I didn't know any better, I'd say you're optimistic about the future. Right.
Listen, I do this work. I'm always going to be optimistic. I don't know that we're ever at a loss for hope as long as we continue to be thoughtful, innovative, and entrepreneurial. But if we get to be politicized, if we entrench, then I'll lose hope. If all we do is scream, I'll lose hope. If someone says to me, no, that we just have to close the shop for the next 4 years, I'll lose hope. But that's not what public health is.
Brian Castrucci, thank you so much for being a guest on Public Health on Call.
Thank you, Josh.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Fernandez-Cesiri. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Social media run by Grace Fernandez-Cesiri. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.